In that video, I would like to talk about 1 month post surgery. My gallbladder was removed, and in total, last year I had 4 attacks with my gallbladder, and the first one happened to me when I was 5 weeks pregnant, and we went to the ER on vacation in Florida, and the doctor in the ER, because of intensity of the pain, location of the pain, he suggested that it is problems with gallbladder. And upon return to New York, he suggested to see my gastroenterologist, which we did. But because of my pregnancy, we could not go for a CAT scan or MRI to look in the gallbladder. So the sonogram showed no stones, just a little bit of sludge, which is normal. And so we just continued with the pregnancy. And because I'm just such a weak on the food, you know, I'm craving a lot of things. I'm pregnant, so I was just eating pretty much healthy, but sometimes, you know, I was giving up and eating croissant or, you know, fresh baked bread and some sweets, chocolate. You know, chocolate have more than 20% of fat in it, so it's really like not allowed if you have any gallbladder problems. So by the week 21, 22, I was at work eating, like in the morning I had yogurt, I had croissant, 2 cups of coffee with milk. You know, I would like to drink my coffee with milk, and usually I was going with a whole fat milk, and as it came out, it was a big mistake. So in the morning, during like first hours before lunchtime, I started experiencing this burning sensation in my stomach, and so it was the beginning of this gallbladder attack. By the time I got home around 4 p.m., the pain was already like the first attack. It was very intense, feeling like somebody stabbing you in the stomach and just continue stabbing you in your stomach with a knife, and you cannot sit down, you cannot relax, you can't do anything. All I was just able to do is walk around the apartment. I started cleaning or moving, doing something. So if I have stones stuck in a duct, so no, you know, you want to move a little bit so to help it to go through your duct if it's stuck. So it didn't help me. I had to go to ER again, but this time it was like completely different experience. Was vomiting with bile, and pain was not going away. Hours and hours I was in the ER, transferred to the hospital, Maimonides Hospital in Brooklyn, New York. Then I was hospitalized for 2 days. The team of surgeons and OBs was watching me, and nothing to eat, nothing to drink. All the medication, pain medication that was given me, including oxycodone, didn't help me at all. What helped me is fasting. So the fasting helped me to get out of this attack on the next day at 21, 22 weeks pregnancy. So I got home after this attack, and just to mention, my husband, he's enjoying doing sport, he's going to the gym, he's eating mostly healthy food, and you know, for him it was very easy to help me how to start eating healthy. And because of the fear, I decided, you know, I can do anything just to not experience this pain anymore. It was very, very painful. And plus at 20 weeks pregnancy, you already, you know, you have a bump already, and your stomach is all stretched out, and your baby pushing on the organs, and it makes everything worse. So since July 7, July 8, I started following no fat diet. So I was buying no fat milk, which looks like water mostly, and eating chicken breast, fresh vegetables, fresh fruit, and drinking bunch of water. And there is no soda or no sweets at all. I was just like day by day it was going. I was bringing lunch to work. Sometimes I cooked at home, and sometimes I was just bringing chicken breast and fresh cucumbers to work, and just boiled it in a frying pan with water and salt, and that was my lunch. And for the breakfast I was bringing no fat yogurt, Greek yogurt with some fresh frozen berries like blueberries, or frozen, you know, strawberries, peach, cherries. You can pick anything you want. But that helped me to go through this pregnancy. Okay, somebody woke up, so I had to go and pick him up. That's the boy who was in my belly when I was having all these problems. And so that brought us to the attack 3 and 4. They came out of nowhere. Just couple cups of coffee. I had, for the third attack, was I blame on eggs, because I made a breakfast with eggs, and he was already born. So it happened in April, and so I made 2 eggs instead of 1. Usually I was making 1 egg and egg whites additionally, and from the box. And so I made 2 eggs instead of 1. And and then just standing, talking to other parents, I got like hit in the stomach, and my stomach started just hurting. I could not breathe, and then just walked around, and I called my husband, and he was just in shock, doing, you know, what we're gonna do. We have to go to the hospital. But walking around probably helped me, because sometimes the small stones getting stuck in your ducts. So I was walking around, like in 10 minutes my pain was gone. And the last time I had another attack, it was like maybe 1 month after that, and I had a cup of coffee with my friend. We went to pick up my 3rd child from school, and on the way there I just feel that attack is coming, and there was an attack again. You can't breathe, you can't talk, it's just so miserable. If you have this kind of pain, you know, you can share experience with me, and I just want to give you, you know, all the support you need, because it's very painful. And if you're pregnant or just delivered baby, I couldn't hold my son, because this pain is just so intense. And so you cannot really continue with your day. But luckily 10 minutes after, the pain was gone, and my husband and I had a sit down, and we made a decision after gastroenterologist visit that we're gonna go and do the surgery and remove gallbladder, because we didn't want to have any problems with my liver or pancreas. You know, when you can get infection, and emergency surgery is always worse. You can get you can be hospitalized for days after that, and until you get better with your liver. So June 15, I went for the surgery to New York Presbyterian Brooklyn Methodist Hospital. I stayed there all in total maybe 5-6 hours. Very easy. In the morning, 2 hours before the surgery, preparation, surgery, then they bringing you to, you know, to post-op room, and 2 hours maybe later my husband came and picked me up. So we was at home by 1 p.m. So the post-surgery and recovery, first days, first week, the diet was very specific: clear liquids, chicken broth, Jello. My husband brought me zero sugar Jello. Then just clear rice, just salt, a little salt and water, and that's it. I was making toast, 100% whole wheat bread toast. Mostly no appetite. I did not feel extremely hungry, drinking a lot of water, and I had very bad gas pain because the surgery was laparoscopic. They made 4 incisions in total on my stomach, and tiny little holes. And the CO2 that they put in your stomach to stretch it out from the inside gave me later these problems with my gas pain. I had both shoulders pain for at least a week. Recommendations from the surgeon: you cannot lift up anything heavier than 10 pounds. The baby was already 20 pounds, and I could not lift him up. My husband was carrying him around from the bed to the floor where we were sitting, and I can change him. The move's very limited. You can feel right away when you cannot, you know, really stress your belly out. After the surgery, I was wearing a bandage on my stomach constantly. Like, you know, you can ask for the bandage, they're giving you a new bandage. And this bandage was helping me to hold my muscles together and you know, move baby around on the floor, change his diaper, because it's a lot of things you have to do. Unfortunately, you cannot just, you know, opt out from housework. Your husband is working. He was able to take a couple days for post-surgery and the day of the surgery, but then, you know, he's back to work. You have children to take care of, and you need to do some cleaning, some cooking. So that you know, that forced me to start moving around more and use that pain medication that over the counter, because the surgeon prescribed some mix of the pain medication with oxycodone, which I did not want to use because I'm a breastfeeding mother. And so I just didn't take this oxycodone contained pills. Was using regular Tylenol and Motrin, and just switching this pain medication. With the gallbladder being removed, the symptoms that I have mostly related to H. pylori, because I was not able to kill this bacteria on the first course of antibiotics. I still continuing on a diet with you know, pretty much the same diet I used to do before the surgery. So thank you for watching this video, and if you stay whole video together with us, with me and my son, then please subscribe to my channel and put the like, and I'll see you in the next video. Thank you so much. Bye.